So as Dr. Prabha had mentioned, this child, is this pregnancy wanted? Was the first thing. Was it planned? Has it come too early, or has it been something which has waited a long time? So a lot of anxiety has built up. Certain things like age, so many women come to me at 30, 32, 34 telling me I'm very old. And I'm like, no, you're not. And this concept that at 36, 38, suddenly something happens to your systems because of which, something's going to happen to your baby. And I keep explaining to them that in the West, it's not like that. It is your fitness which is important, not the age in carrying the baby and going through. I don't think it's necessary to really frighten women about diabetes and high blood pressure and things like that when they come in, just because they happen to be 34, 35 and this is their first pregnancy. I think we can watch out for them, do the tests, tell them what are the issues, but not scare them. And I think that is very important, giving them confidence. And I often ask women, and I would like health workers to ask women, what are the things you worry about? And as someone had mentioned, they have a friend who's told them a terrifying story of labor. They have a friend who's lost a baby. They may have people who have had problems, who've had a child who has some special needs. So all these things are worries. Another thing is, I often ask them, do you get nightmares? And when they ask, then they look at me blankly. I say, pregnancy, especially the first one, is such an unknown thing. And like for our exams, when we went for our exams, it was very unknown. We would often have nightmares about going to the wrong center, going for the wrong exam, studying for geography when it's history, things like that. The same way your pregnancy is an unknown to you. So you'll often think of it. And I then ask them, what is the biggest unknown in our lives? And then either the husband or wife or mother will say, dying. And I said, yes. And therefore, very often, you may have dreams about dying, about the baby dying. And when I say it, I see this look on this woman's face saying, yes, I do. I have night dreams that I've died, and then, people are running around. And I said, that is just that your subconscious is saying something to you about a worry, and it doesn't mean you're going to die. And so spaces like that, so health workers can ask things like this. I don't know why sometimes death or anxieties are things we feel scared to talk about. After delivery, I have often spoken to women saying when they've come in their second month, do you sometimes feel like leaving the baby and just running away? And they go, yes. I said, do you want to give the baby away to someone saying, I've done my job, I've had the baby, keep the baby, I'm out of here? And they go, yes. And the feeling that it's natural, that having a baby is a 24/7 job, which is terrifying. You have this little life in your hands and you think, if I don't do my job properly, something will happen to my baby. Is very scary. And so being able to bring that out for women and then talking to them, because they feel like at home, don't talk about these things. It's not good to talk about negative things. So I also, when I discuss these, like the husband and whoever the senior women in the house, caregivers coming in some families, especially now during Corona, a lot of couples have not been able to go back to their parents' home. Neither have elders been able to come here as was planned. So they're very alone. And they are facing, so a lot of times you have to be loco parentis in trying to explain to them simple issues which they need to look at and worry about, and what should I go to a hospital for, what are the things I should look at, which an elder mother or someone would have been able to help with them. So these are things I would like health workers to really say, what are you worried about?